Good evening, everyone. I'm Amy Hecklenberg, an associate professor and the assistant dean for diversity and inclusion in the School of Nursing here at the University of Buffalo. On behalf of the School of Nursing and our Diversity and Inclusion Committee, I'd like to welcome you to tonight's special event. Dr. Susan Grinsley will serve as our moderator tonight. As the Associate Director of the Buffalo Center for Health Equity and a clinical professor in our School of Nursing, she's worked tirelessly with the task force to improve the health outcomes of African American and other communities of color in Buffalo. Before I turn it over to her, I'd just like to cover a few housekeeping points. First, I'd like to thank those of you who contributed questions to the panelists via the registration process. We're gonna try to cover as many of those as possible tonight, but we did have a lot of them. And also note that the chat function is activated in Zoom, so feel free to introduce yourself, provide your position, your pronouns to everyone. If you have questions, you can share them there too, and we'll do our best to monitor that and get to those questions as time allows. So without further ado, I'd like to hand this over to Dr. Susan Grinsley to begin our conversation.
Thank you, Amy, for that. I appreciate that. I'm going to introduce Pastor George Nicholas, who is the convener of the African American Health Equity Task Force and is pastor of Lincoln Memorial Church. Pastor Nicholas, would you just provide us a little bit of background for yourself?
Yes, good evening, Dr. Grinsley, and good evening, the UB School of Nursing. I wanted to just say how grateful I am for this opportunity to come and just share some time with you, and thankful that you took the time to be with us this evening. I'm just a pastor at Inner City Church. I have a little bit of background. I used to be the CEO of Geneva B. Scruggs Community Health Center, and I have a passion for health. And, I have one of my degrees, I'm an undergraduate of The Ohio State University. And I have a master's from University of Buffalo under Dr. Taylor's program. At that time, it was called Applied Public Affairs and Public Policy Studies. And I also have my master's of divinity from Colgate Rochester Divinity School.
Okay, can you tell us a little bit about how the task force came to exist and a little bit about its history over the last several years?
Yeah, so back in 2015, was engaged in a conversation with Mary Walls. At that time, she was serving, working around colorectal cancer. I think it was for the American Cancer Society. And we got in a conversation about, getting the Black church more engaged in dealing with colorectal cancer. And I challenged the group to say, well, wait a second. I believe that many of the issues that were causing a disproportionate number of African Americans to have colorectal cancer, I bet you that goes throughout the board. So why don't we take our time to do some research and look at how wide and how deep the health disparities are in Western New York, and specifically Buffalo. So we looked at 5 or 6 zip codes that comprise what we would call the east side of Buffalo, and found that, and just using state and federal data and county data, I believe too, and just mining the data. We didn't really have to go out and create any kind of research. We just looked at what was already there. And we found that African Americans who live in these zip codes, 14215, 08, the ones that you know on the east side, they had a higher prevalence of chronic disease. And we knew that, but we didn't know the extent. And we found that an African American living in those communities has a 300% higher prevalence rate than a white person living outside of that community, meaning, cancer, hypertension, diabetes, all the things which we call chronic diseases. And then when we projected that over lost years of life, we found that, again, if you lived in those communities versus whites who did not live in those communities, there would be a 10 to 12 lost years of life. And so that meant less time where our seniors spending time with their grandchildren, less time. And you could really see it, Dr. Gridley, what was at that time, you know, there was this a great push about the waterfront and everything. And you'd see, and oftentimes I noticed anecdotally, this is not, you know, research on it, but you see often you would see three generations of white people down there, you know, a grandfather and a daughter and maybe a grandchild. But very quite often you would not see that in our community, because and a lot of times our seniors are not with us anymore, or they're in such a poor physical health that, you know, spending an afternoon in the park is just not something that was realistic. And so we published the report, and I don't know what slide we're showing right now, but you know, and I want to kind of go through this presentation. I will at one point, but if you go on to our buffalohealthequity.org, buffalohealthequity.org, you will get an opportunity to look at that data and look at the, you know, what we found.
Okay. What are the specific missions and goals of the task force and the community center for equity?
Okay. Well, you know, the African American health, and it started with the African American Health Disparity Task Force, right? Mm-hmm. And our stated goal at that time, our mission was to, and it still is, to eliminate race-based health disparities. We don't believe that your race should be a contributing or determining factor towards your health outcomes. And so in terms of focusing on the social determinants of health, and that was one of the big things, Dr. Grinsley, that we wanted to kind of reshape and change the narrative within Western New York, right? When there's conversations about in the African-American community or about the African-American community as it relates to health, there's a proclivity to jump towards a behavior, saying, well, you know, people are, you hear it often, even, I mean, just, it's so, you know, insulting and just shows just really a lack of understanding. You know, people say, well, you know, at your church dinners, you guys have all this fried food and all this other stuff, as if you know, we eat church dinners every day. But the fact is that when you look at the social determinants of health, when you look at what the CDC, NIH, all reputable health institutions and organizations, they say, the social determinants of health are the things that have the greatest impact upon the health of an individual. And I would even argue that even as it relates to health in the African-American community and behavior, when we say things, for example, that you need to eat more fresh fruits and vegetables, well, if you don't have those venues within your communities, that makes it increasingly more difficult to do that. And then with the economic disparities that we see in between Blacks and whites, the income disparities, wealth disparities, unemployment rates much higher for Blacks now. So, and then when you look at healthier food is more expensive than processed food, right? Now you're also looking at different factors that are going in. And then when you factor in also the challenges as it relates to transportation, public transportation, or access to vehicles, knowing that not only, you know, with your economic situation, but if you do own a car and you live in the Black community, you're going to pay higher auto insurance, right? So there's all these things that contribute to making it a challenge just to go and get fresh fruits and vegetables for your family. And so that impacts the behavior, right? So at one level saying, well, you ought to do this, but then if you don't factor in all these other challenges and obstacles, then you're really, I don't think you're getting at the root.
Okay, thank you. And what about the Center for Health Equity?
So when we had one of our recommendations from our first report was to establish a community-based organization within the community, embedded in the community, that would focus solely on the social determinants of health and coming up with programs and policies and strategies to address these health disparities in the community. And so after an investment by our backbone organization, Erie County Medical Center, there of $372,000 a few years ago, we were able to stand up the Buffalo Center for Health Equity, which has several goals, but the main thing is to really work on programmatic development, policy, advocacy, community engagement, and research to develop, and we were to develop plans and then implement those plans to address the social determinants of health. But we don't want to become a big bloated service delivery system because we have enough of those in Western New York. But we really want to function as convener, create tables and conversations for us to bring forth some innovative approaches to address some of these issues. We had two major conferences, Igniting Hope, well, actually three, Igniting Hope 1 and Igniting Hope 2, which were held right there at the Jacobs School of Medicine. And then this year, because of COVID-19, we did it virtually. And that was a booming success as well. And in those meetings, we had like, I guess, 300 to 400 people participating in both those sessions. We brought professionals from the university, and we brought scholars from around the country, and they gave presentations, but we also had breakout rooms and breakout conversations where community residents and others, concerned citizens, could engage in conversations to develop plans and approaches to addressing these issues. And so out of that came the Buffalo Center for Health Equity. And then further down the road, through a lot of your advocacy, and we embarked on a journey of developing an institute embedded in the University of Buffalo to focus and concentrate research. And again, not only research, but develop responses to the data, right? It's one thing to research a community and then outline all the deficiencies, but it's another thing to work shoulder to shoulder with the community to develop approaches and innovative ways to address the things I've identified, and also to engage the larger institutions to provide support to these approaches. And so we're very excited about the establishment of the Institute embedded in the CTSI over there under Dr. Tim Murphy's leadership. And so we have simultaneously the Buffalo Center for Health Equity, which is a community-based entity. And then we have the Research Institute embedded into the university. And they're not working in conflict, but they work in concert with one another. And we've already embarked on some joint funding proposals, and we've embarked on a number of other activities to bring the university into this solution. We believe that universities, they're designed to solve big problems. And the University of Buffalo has expanded a great deal. It's put a footprint in the inner city by having the big medical school there. And so we feel it's appropriate for not only the medical school, but the entire university organization, because we're not just focusing on what happens within the healthcare system, but we know that the social determinants of health, those are things that operate outside of the healthcare system. So that's why we're glad to have the School of Law, the School of Management, the School of Nursing, the School of Social Work, the School of Education, all these different partners that have come around the table and said they're going to work with us on this.
Thank you very much.
Interrupt, Pastor. Is there a slide we should be looking at right now?
Well, I think at some point I kind of want to walk through these slides a little bit, but I'll just continue to answer these, having this conversation with Dr. Grinsley, and then at some point I will kind of walk you through a couple of things in the slides. So just you can keep the Health Equity Center side up if you want, or whatever makes sense. Okay. Thanks, Jim.
one of the things, well, obviously, we're all experiencing the pandemic. We've certainly heard in the newspaper and an announcement that the African American community has been disproportionately impacted by the COVID-19 pandemic. Has the task force or the Community Health Equity Center, have they responded to that?
Well, yeah, I mean, right from the beginning, you know, when I recall, you know, when the pandemic, when news of the pandemic first came out, maybe March, maybe earlier, what my colleague, Rita Hubbard Robinson, gave an impassioned plea to us at a task force conversation about the pending impact that it was going to have upon the Black community based on what we already knew, right, in terms of the pre-existing conditions and the poor health in the Black community already. And so when it became obvious that it was going to start showing its ugly face into Western New York, we quickly got on the phone with the county executive and the health commissioner and a number of our other colleagues and partners, and said, "What's the plan? I mean, you know, this thing, it's not on the way; it's here." And because we had done our homework, and we've been doing this work for a long time, identifying the social determinants of health, identifying the fact that diabetes, diabetes, heart disease, and asthma were already at disproportionate numbers in the Black community, and knowing that those three illnesses are something that made a person more susceptible to COVID-19. We were insistent, sadly, and it's not a hit at anybody. It's just the way systems work, and you know, we were all kind of taken about. There was not a clear vision on how we were going to address this in the African American community, and so, you know, we went to work. We were insistent in saying that, you know, we had to make sure that there was access to testing, access to PPE, and that there had to be some mechanism in which we utilize the existing community health centers and community practitioners like Dr. Vasquez with Jiban, with Community Health Center, Levon Ansari, Dr. Glick at Jericho Road, Dr. Alusu with Rafa Medicine, and all these other. So there were already practitioners that were operating in the Black community, right? And so they needed to be brought into the conversation on how we would respond and address these issues. And so we were able to stand up what they call the COVID-19 response team, which we were able to embed with COVID response call centers within 15 churches on the east and the west side. And we just began the process of calling people, right? We got lists from the Board of Election and other sources, and we just hired young people. We had a lot of college students that were home because their campuses were shut down. Dr. Vasquez had come up with a very innovative way in terms of through the Hulan system, through IT and whatever, where our responders could make appointments right there in the church. Not the appointment wouldn't be in the church; they could make the appointment using technology, and connecting people with. And then we knew that food insecurity was going to be a great challenge. So we embedded in our work the ability to provide food for people who were going to be in trouble. And we utilized, again, existing resources within our community. Alex Wright, in the African Heritage Food Co-op, I believe that's the name of it, who was already doing food work. So we said, let's empower him, let's equip him. He already knew the community. And then we also realized that a number of people, even though everyone thinks everyone has a cell phone, not everybody has a cell phone. Not everybody has a landline. So we realized that we needed to knock on some doors. And so the National Witness Project was already in community, operating and providing information to the community around health. So we equip them, say, okay, what do you need in order to help us in this project? And so we were able to, we probably have touched about or reached out to about 100,000 people within community and have provided probably close to $500,000 worth of food. And we've connected people to primary care when they didn't have it. We knew that mental health was going to be a challenge. So we had the capacity to working with Best Health or Best Self-Help, that mental health organization, to make connections and referrals into, and we trained our responders to be able to provide good triage, to ask the right questions, and to listen carefully, and so that we would be able to provide the help that people needed. And so as a result of our innovation and intervention, right, we were able to avert a major disaster in Western New York, especially the Black community. When the early data came through, and what was interesting, some of the first people who we lost within community as a result of COVID were people that folks knew, right? And that it doesn't make them more important than anybody else, but there were people new, there were familiar faces, and some of them were some stalwarts within the church community. And so it kind of shook a lot of people. And so when the clergy, who at first were not as receptive to shutting down, to, you know, the Lord's going to take care of us and watch over us type of stuff. And I do believe that. So, you know, nobody's going to out Jesus me, but we also use our minds, right? And so to say to folks, listen, you cannot gather right now. You cannot do the things that we have been doing because this virus is spreading around. And by and large, you know, the church community on the East Side did better than most communities. And so the initial data came out, and we were trending right at what the national average would be. You know, what's happening right now, if you look at the data across the country, African Americans are dying at about 2.5 to 3 times the rate of population. Right. So Erie County's population is 14.6% African American. The early numbers showed, and this was prior to us really kind of engaging fully, was about 33% of the early deaths were from the African American community, which puts us right at that 2.5 to 3 times. But then when we got to work, and it was a really collaborative team effort, happy to say that from the latest data, that deaths are about 16%, which is pretty much right at the population rate, and a significant drop from the original data. And we've had the opportunity to share our story with people across the country, and they're quite surprised. And so, but it's really important that we have innovation, to bring collaboration in, empower people that know what they're talking about at the ground level, right? And so there are people that are already working in these communities. We resource them. Then we set up satellites. We set up a testing site at the Leroy Coles Library on East Devlin, I believe the street it was. And then there were other sites, and we said, listen, these community health centers, they need to have the tests, they need to have the equipment and the things that they need in order to serve the community. Everybody's not going down to Kaleida. Everybody's not going to somewhere to go. We need to be able to have spaces within community where people can get some help. And the county executive was and is very responsive. And I think we've been able to do some pretty good work in Buffalo. You're on mute, Dr. Grinsley.
Understanding that you've continued to sustain this even today and have extended it into other areas of poverty within Erie County. Is that correct?
Yes. So my colleague, Reverend Pointer, is the chair of the County Poverty Commission, I think, with the county executive's office. And so the county executive saw the good data, the good results that we're getting, and asked if that model could be expanded out into rural communities, right? Because there are communities like in Eden and other places where, you know, there's some similar social determinants of health issues, absent of the issue of race. And I'm at some point tonight, I really want to go through these slides about race, because I think this is an important story about this, and provided additional resources to expand the program to where I think we have about 25 churches now. And we're continuing, we're still calling, we're still feeding. As today, we were sending out food, and we also have stood up some food pantries within some of these 15 churches, and my church included, Lincoln Church. And because we know that people are, they're having economic crisis right now, and food is a real problem. And so we were able to take resources from the program and help build up food pantries in these churches, so that as people come in, especially during Thanksgiving, where we were able to, within a couple of hours, serve about almost 100 families. And so this is just a microcosm of what's going to be happening all around the community for a while. It's going to take us a minute to kind of recover from this. So it's really about making sure we resource people that are going to use the resources. They know the community, right? And know how to make those resources be most effective, right? And so that's kind of where we are with that. And it's really not a lot of money. So I think we're talking about 1.5 or 2.7 million for the second round or something like that. And when you look at the impact that we've had with those dollars, and it's not like they come out of the county coffers, they were connected to the DSRIP dollars and the Millennium money, which, that whole program was designed to address these kinds of issues in terms of health disparities in distressed communities. So this was a perfect, I believe, usage of these dollars. And they really have been able to help a lot of people.
Okay, why don't we divert and go to your slides, and then we'll add some additional questions.
Sure. So, and I'll just let me go through this, and I'm going to be really anxious to have conversation with you. At the root so when we look at these issues around COVID-19 and the impact it had on Black communities and brown communities, when we look at the social determinants of health in general, right? The fact that we live in a nation which, has tremendous wealth, stock market has gone out the roof. Our military is the largest military operation that's ever been assembled in the history of humanity, right? And we invest, just a disproportionate amount of dollars into that. But yet, at the end of the day, we still have an entire segment of the community, the African American community, people who were brought over here. We didn't migrate. We were brought here against our will, enslaved, and have had to deal with tremendous amounts of oppression since day one. Well, so when this COVID-19 hits, it was easy to be able to make an assumption, an educated assumption, that the Black community was going to be hit the hardest. And this is true about everything as it relates to health, right? And one of the biggest challenges that we've had, I think, in doing this work, I've been doing work around issues of race and equality and justice and what have you, has not been I spent no time worrying about what Trump and them do, right? Or the Proud Boys and all that other stuff. I spent none of my time thinking about that, because at the end of the day, they're not going to be integral in bringing forth solutions to the problems that are facing the community. We understand where they are. We have no expectation for their help. But what has been the biggest challenge is the at times, the lethargy of people who position themselves or call themselves our allies. Oftentimes people like to quote Dr. Martin Luther King, and I always wonder if they really have read his work, right? I mean, I think, a lot of us have heard the speeches and seen the little news clips and what have you. But when you take the time to really read the writings of Dr. Martin Luther King, you'll find that he was extremely progressive, especially around the issues of creating what he would call the beloved community or creating the just society. And certainly his last work, Where Do We Go From Here, which he really laid out a clear vision of how to create an equitable society across not only race, but also across class lines. And the biggest pushback, and King would say these words, these are his words, in the end, we will not remember the words of our enemies, but the silence of our friends, right? And so a lot of times when there's, and Rita talks a lot about these issues between equality and equity and what have you, and I think there's a lot of support from the white liberal community around equality, and I think there's very tepid support about the issue of equity, right? And because equity is what creates the environment that allows for each individual to freely pursue prosperity in an unfettered way, without institutions and others pushing back against their success or their quest for success. And so when King began to push forward, and after civil rights legislation and the voting rights bill and all this was passed, he found that there seemed to be folks kind of taking victory laps and not really continuing that pursuing of equity. He said, what good is it to be able to have a seat at the lunch counter, if you can't afford a hamburger, right? And so now when you start talking about economic equality, then that changes. That's another dynamic. It's one thing to tell people to remove the whites only signs on their public facilities and public accommodations. But then there's another thing when you start talking about, now let's create a community where there's equity for all. So in our work with the Buffalo Center for Health Equity, that's why we say equity, we're intentional, next slide, in bringing in the kind of partnership and holding people who want to be our allies who claim to be our allies, holding them accountable, creating spaces for them to work with us, right? But saying that you got to invest, right? We just don't need you to do, tepid, episodic activities, right? But we need you to make us part of your DNA, the quest for equity. And you'll see there on the one side, the Community Health Equity Research Institute there, right? And Rita probably gets a good chuckle out of this picture with me with a bunch of politicians, which was probably the only picture in the universe with me smiling with a bunch of politicians. But those who know me will understand that. But the fact that we were able to bring this type of collaboration embedded in the institution, right? So UB, let's be honest, does not have a glorious track record of working with and shoulder to shoulder with the Black community. There was tension, right? And some of us, took some heat by saying, no, we're going to work with the university, because the university it belongs to us, right? It's a state university. Last I knew, I live in New York State. I have a degree from the University of Buffalo. It's on the east side of Buffalo now, with it being so there's a responsibility, right, to partner with us. And so by embedding this institution, now it becomes, UB says, no, it's not a them thing, it's a we thing, right? Because we're putting our brand on this, right? We're putting some skin in the game. And, you see Dr. Murphy there, we're saying, yes, let's put this, I'm going to be accountable for this. I want to see the success. And President Tripathi said, I'm going to put some skin in the game and make sure this thing works itself out. So that's critical. And then on the other side, you see the Center for Health Equity. You know, these are the things that we're looking at, you know, historic trauma, policing, maternal health, restorative justice, mental health, tobacco reduction. We're working in partnership with Chickatelli and Associates and Project Reach on that. Nutrition, we have we've been working on this corner store initiative long before COVID started, right? And working on issues and creating nutrition. Part of our work plan is developing a Project Rainfall in terms of developing a fresh fruits and vegetables institution where we can grow vegetables year round and create jobs and do things right there on the east side of Buffalo. These things need to be invested in so they can work. Elon Musk got $750 million and has not done anything to help Black folks. Well, I'll take 10% of that. Shoot, give me 75 million. I don't even need 750 million. Well, you know what we could do with $75 million, right? And so, but these are the kinds of conversations that have to take place. So we'll bring real change. When you look at policing and restorative justice, we know that there were unjust fines and fees that were being levied upon people. So you look at the same communities with the highest number of health disparities and health inequities, and these are the areas that were getting the most tickets for stuff like busted headlights and tinted windows and nonsense like that. Not safety, it had nothing to do with safety. And so we empowered and worked as part of our Fair Fines and Fees Coalition, and we were able to get those things eliminated. They're off the books in the city of Buffalo, right? And so this is the kind of innovative work, and when I labeled that the outcomes of the African American Health Equity Task Force. So partnership. Next slide, please. And then Dr. Grinsley had asked about what's our work at this Buffalo Center for Health Equity? These pillars are critical, right? This is how we're going to operate. At the top, there's research. Now, the Research Institute, the UB is going to do research, but we're going to do some of our own research too. We'll do some in collaboration. We'll do some on our own because it's important to have community-based research going on as well and participatory research going on as well. And then we want to work on neighborhood development. Dr. Taylor is part of our team, and you can't really transform individuals until you transform their communities. And so there has to be a plan on how to redevelop neighborhoods in a way that's going to promote health for people in the community. Community engagement. We believe that people know what they need and they know how others can help them, right? And so community engagement is just that, an engagement. An engagement is not a parasitical relationship where one person just reaps benefit from the other, but it's, there's a sense of mutuality in community engagement. And that's a very important pillar for us. And advocacy and communication. A lot of times, later this week, Dr. Alan Lessie and I, and when I say I, when I'm speaking for the task force and Health Equity Center, we're going to be hosting a town hall to talk about the vaccine, because there's a lot of information. There's a lot of good information. There's a lot of crazy information going on out there. So we want to make sure that we bring have those conversations in community. And we want to do advocacy that's connected to policy development, right? Research will give you data. Data will help you drive policy, and then policy will bring resources. And so we want to make sure that we have good policy that is going to help us create a more equitable community. Next slide, please. So that's how we're going to work as a center. Now, when we think about the social determinants of health and the impact of systemic racism, right? And one thing about us, we talk very clear about issues of race, institutional and structural racism. For us, there's not a debate about it. It's something that is just part of the American experience, right? And so when we talk, for us, you can't have a conversation about the social determinants of health and not have a conversation about systemic racism. So in the center, we like to do a lot. I remember having a conversation with a foundation and say, Pastor, we love the work you're doing, but we really want to focus on children. Oh yeah, okay. Everybody likes kids, right? Except for when you're taking kids and putting them in cages on the border, but that's That's what, you can invite me back and we'll talk about that. But when you think about children, every child needs to be nurtured. They need education. They need caring adults. But what impacts that is that family, right? And the family needs to have access to health care, stability, income, and employment. And that needs to be in a neighborhood, right? With parks. One of the social determinants of health is the issues as it relates to the environment, access to fresh water and air. We have, I mean, we should be like embarrassed as a community to know that we even have a neighborhood where people live, and it's called a cancer cluster, right? The fact that we even have that, right, should be like, wait a second, we can't do that. That's crazy, right? And we got to do whatever is driving this cancer cluster, right? We got to deal with this, right? And so environment, and we know, again, a lot of neighborhoods where Black folks live, you know, built in places that weren't properly remediated, brownfields, all these kind of stuff. And it contributes to negative health outcomes. And then the state, when I say the state, not New York State, but the state itself, right? Representation, policy, and resources. So every one of those rings is impacted by systemic racism. And so instead of helping push this child out, right? A lot of times these things are pushing the child down, right? And so if we want to really do some things transformative, we got to address everything in those rings. Next slide. What is exciting is that there seems to be an appetite in America as a result of what happened to George Floyd, Breonna Taylor, Ahmaud Arbery, and others, and the civil unrest that we saw in our nation over the summer, was a sense of trying to get a better understanding of racism. And over the summer, at one moment of time, the top 10 books, nonfiction paper books, they were exclusively, I think all but one, were anti-racist books, right? So there was this appetite to get better understanding. So I think that's very encouraging. It's so interesting how racism even plays out in this, right? So while I support the work of D'Angelo and White Fragility and her other texts, that's not the definitive book about racism. It's a good book. It's an important book, but it's a book that needs to be read in context with what Black scholars have been writing about for a generation, right? So if you only read that book and you don't read, you know, Cast by Wilkerson, then you're really not you're not doing yourself a service. You want to be able to get a broader perspective. Next slide, please. And when we engage in, one of the great things about our task force is when we put out a definitive statement and started talking about being anti-racist, right? And again, we can't shy away from these conversations. We can't get squeamish about them, because but only by engaging in these conversations that can we resolve and solve these things. And you see the era of racism and white supremacy, the ideology, they feed each other, right? They feed each other. And when we talk about this, we're talking about things systemically, right? And so we must understand the origin of this in terms of it. In terms of, it gave a justification to conquer. When you move and go onto somebody else's land, and then you grab some other folks to come work this land, you have to create an ideology, because you know it's wrong, right? You know it's wrong. So you have to create some kind of thought process to make it be perceived to be, or you believe it to be right? The doctrine of discovery, right? You know, all these things that we're taught, right? The white man's burden. We theologically, We think there was some providential action taking place. You know, think about this. Think about this as me as an African, person of African descent, and one that believes in God and believes that, you know what, yeah, it's part of God's plan for my ancestors to be stolen, raped, abused, you know, just so we can have iPhones in America 5 generations later, right? Come on. That's just so we gotta have conversation about that. And we understand the purpose around racism and white supremacy and the ideology is financial and political control, right? It allows for that kind of control to maintain, you know, just power, final one. And so you bring it through every strata of institutions, right? In order to maintain your dominance, right? And so we have to engage that conversation at that level, as opposed to, yes, the people, you know, who were out, I think there were some people out somewhere in Buffalo this week, you know, with some hoodies on, doing weird stuff, right? Yeah, we need to deal with them, but we need to deal with what goes on in boardrooms, what goes on in the Saturn Club and the Buffalo Club, right? I'm more concerned about the conversations in those spaces than, you know, a bunch of people who don't even understand that. I don't know what they understand, but they don't have the power to really maintain things. Next slide, please. Just a couple more. And so again, I think we're in a moment right now that that people of good conscience from all communities have to have their voices be heard and begin to start building the society that we want to see, right? So if we're happy with this continued health inequity, we're happy with seeing, you know, just yesterday, another Black person was killed by the police in Columbus, Ohio, right? There was a Black person that was shot in his apartment in New York City the other day. In his apartment, right? Now, he was a little off. He needed some help. He didn't need to be shot. He needs law enforcement to kill him, right? And so we have to begin to draw more people into the conversation. Bishop Tutu said this because when he was in the midst of his struggles going on in South Africa, and he would say these words: if you are neutral in situations of injustice, you have chosen the side of the oppressor. If an elephant has his foot on the tail of a mouse, and you say that you are neutral, the mouse will not appreciate your neutrality. So we have to liberate ourselves from this. Sometimes we personalize whether or not we're not doing the bad things, right? Right. So just being neutral is not helpful. Neutrality helps to maintain the status quo. Next slide, please. I just got a couple more and then we'll have time for some good questions. Please, I beg upon my white sisters and brothers to be free. Be free of this statement. When we start having conversation about systemic racism, I'm not a bad person. Okay, I know. That's good, right? But here's what happens when we start to try to talk about things systemically, and then you start talking about yourself and I am not. What you're doing is you're centering your whiteness in the middle of our struggle for liberation. And now it becomes all about you, right? And so quickly, when racism is centered on individual feelings, it's difficult to address the systemic impact, right? One thing that D'Angelo does a great job in her text is that when she starts talking about white tears, right? And we've all been, and I don't know, I can speak for all, I'll be speaking I statements. I have been in so many meetings that are designed to talk about systemic and structural racism and what have you. And invariably, a white person breaks down in tears about their experience about some Black kid they went to high school with and they were friends, right? And it's warm and it's touching, but it's completely irrelevant. And then what that does, it sucks all the emotional energy out of the space. right? And that becomes about comforting this individual and dealing with the trauma of, whatever, you know what I mean? And so we have to be careful of that. White feelings will shut down conversations on race. I've seen it. It happens too often, right? So if you're feeling emotional, right, that's cool, but understand, let's stay focused upon what we're trying to do systemically. Whites must be able to see racism through structural and systemic lenses, right? You got to focus on the system, because the data will show you how the system is functioning, right? So if we tell you that we need more, there needs to be more Blacks in the School of Nursing, right? Your story about that one Black student you had, that was great. That's a good story. We enjoy it. But again, let's stay focused on the structure and the system, right? You may not have caused it, but you benefit from it. This is something I've had to reconcile in my own journey around the issue of male privilege and the issue of heterosexual privilege, right? Understanding that while in my own personal practice, I do my best not to engage in sexist language and behaviors and practices, but understanding that my own personal behavior was not enough. I had to be an ally. I had to speak about when I saw it operating in systems, right? And say, wait a second, this is not right. Wait a second, we gotta, we can't operate on that. And so understanding I benefit from that. And then, certainly within the church, the level of homophobia that's operating in the Christian church right now. And so again, me not saying, well, I don't have those personal feelings. That's not my personal theology. Well, that's not enough, right? There has to be this sense of saying, well, wait a second, let's, either God is God of all or he's not, right? You have a moral obligation. So when I say that, I embrace my own journey in my position as a man, as a heterosexual man, that's something that applies to me. But I'm talking about right now in this context of race, that, this is something I would invite you. Then finally, you have a moral obligation to engage in taking the power away. So what do I mean by this? Will we eliminate racism? No. But can we take the power away from it? Yeah, we can do that, right? We can take the power of how systemic racism impacts so many things. We can diminish that and maybe over generations eliminate it, but we can certainly take the power away from something before you eliminate it. Next slide. And so leaving with this, and this is a quote that, that I'm sure you're very familiar with. In Germany, they came first for the communists and I didn't speak up. Why? Because I wasn't a communist. Then they came for the Jews and I didn't speak up because I wasn't a Jew. Then they came for the Catholics and I didn't speak up. I was a Protestant. Then they came for me. And by that time, no one was left to speak up. So this is our season right now to recognize, celebrate some of the good work that we've laid some good foundation with the Buffalo Center of Health Equity, the African American Health Equity Task Force, I always forget the name. I just call it the UB Center, but the Institute at UB, right? You all know the name. And so we were developing and we're building. One of the things we're doing is we're building a movement. We're not trying to create I'm not trying to create another United Way. I'm trying to build a movement of people of good conscience and allow for them and invite them to engage in some good social justice work in their spaces and also in partnership and collaboration with us in other spaces as well. So thank you, and I'll remain on the line for some questions. I left for some time for some questions, and I hope this answered the issues and things, Dr. Grinsley, that you had invited. Oh, I got one more slide. By the way, sorry about that. The best slide. So 4 key steps, because people always ask us, well, what are we supposed to do, right? Okay. One, recognition, acknowledge the existence of systemic racism. Two, repentance, meaning turning away, stop perpetuating it in our institutions, right? We know it exists. Look within each of our institutions, each one of our spaces, and stop it. Two, reparation. This is a bigger global conversation about returning that which was stolen. There has to be some kind of wealth was developed up the enslavement of African people. It funded the Industrial Revolution. The cotton and tobacco and sugar trade is what laid the economic foundation for the establishment of this republic. That's just, I mean, people can argue that if they want. I can't argue with somebody that's going to argue against that, because it's just like arguing against water is wet. And so we have to figure out some way to restore or to repair that damage, and then we can get to the point of restoration. Right? Path is cleared for unity and equitable relationships. But it's unfair to ask people who have been and continue to be challenged by this system to just jump to restoration. Let's all just kind of get together and hug each other and just say, hey, you know, it's a new day. Well, yeah, it's a new day. But it's really not that new of a day if you repeat the same behaviors that you did yesterday. Or if you don't acknowledge that you might have benefited from some things and it might have at the expense of some other folks, and say, well, maybe we ought to make some adjustments here to make things straight. Okay, now I'm done. Thank you so much.
Amy, do you want to go to questions from the chat, or what would you like to do?
Yeah, I actually was thinking there's a nice transition embedded in what Pastor Nicholas has been talking about in regards to the upcoming town hall about vaccines. We had a question posed during registration that asks, how do we promote an equitable rollout of COVID-19 vaccines to ensure Black and African American groups are not left out? I wondered if you could talk about that for a second.
All right. So that I am going to ask, because I hate it when it's the George Nicholas show. So I see a couple of my colleagues, Dr. Emma, this is a great opportunity for me. The student gets to ask the professor to engage in the conversation. So, because he was my professor when I worked on my master. So Dr. Taylor and Rita, could you jump in and give me a little help on what your thoughts are in terms of responding to that question about the vaccine and making sure that it's available to our community? Is that okay?
I'll go first.
Hey, that's wise, because if you go second, Dr. T doesn't leave a lot for.
Right. I'll let Dr. Taylor fill in the gaps. But thanks so much for the opportunity, and it's really good to be in the room with all of you. And thank you to the School of Nursing for inviting the center to be promoted in this space to talk about our work and its importance. I'm glad also to see Dr. Murphy, who's also been a part of our task force, but now is the chairperson, or excuse me, the director of the UB Community Health Equity Research Institute. And several of us are associate directors, myself, Henry, and Susan. So we're really glad to be here. We're hoping that this is not a one and done. We want to really work with the School of Nursing. The School of Nursing has been very positive. Prior to me working with the center, I was at Millennium Collaborative Care, and Dr. Grinslade, that's how I met Dr. Grinslade, and she was wonderful with her Million Hearts campaign, and many of the students from the School of Nursing participated in the Million Hearts Project. And going into the community, we touched and educated so many individuals around their health and stroke prevention. So again, really glad to be here. So with regard to the question of COVID-19 vaccination, it's a really paradoxical, for me, a paradoxical a place that we're now sitting because of the mistrust of the medical community from past experiences, specifically around trials, around studies on Black responses to syphilis and other diseases, cancers, and other diseases. So there's a question of trust in the African American community where the vaccine is concerned. So as a center, certainly this is something that we're grappling with, and why we're having the roundtable discussion on Wednesday from 9 to 10:30. And I put in the chat the Health Equities, the Center for Health Equities website. So you feel free to please register, and registration is important because if we need more room, we'll figure out how to do that. But we have right now 100-person capacity, so please register right away. Anyway, so we are going to have a conversation. Dr. Alan Lessie, who is the Senior Associate Dean at the medical school and also has over 30 years of experience in working at the VA hospital and is an infectious disease doctor like Dr. Murphy. He's been really our local Fauci, if you will, and has been presenting to both faith community at large, also through our radio program. We have a couple of radio programs where he's been putting out real-time information about COVID-19, COVID testing, preventative strategies, mask wearing, hand washing, explaining about the tick up that we were expecting for our dark winter, explaining how we have to protect ourselves around the holidays. He's been on a number, almost like once or twice a month on various radio shows that we have the Igniting Hope radio program, and we also have Millennium Collaborative Cares, Millennium Health Matters radio show as well. And so he's been really wonderful with this sort of community education around COVID-19 generally, and testing and contact tracing. So on Wednesday, we're going to have this conversation because we know that education is really a key element to making a decision. Because if you go by your gut, and including me as an African-American woman living in America, if I go by my gut, no, I'm not taking the vaccine. Why would I trust the vaccine? Just because, I mean, the political climate and the rush of the whole process, much what America's saying, and then we've got this lack of trust around the vaccine. So I think there's two pieces. One is education. I feel like I have a lot of education around around the vaccine, having just had Dr. Lessie on the radio show this past Saturday. I got a lot of questions answered. I'm feeling more positive about the potentiality of getting the COVID-19 test. I also, having recovered from COVID-19 myself and having really had a close call with my own life. I didn't have a mild case. I was hospitalized in ICU and maybe still recovering in some ways. I know how horrible the disease can be. And so I would say, knowing that, so many people that have died from COVID-19, there's that sort of cognitive dissonance that pervades, that says, okay, I don't want to take it, but we should take it, right? Because we know it will save lives, right? So we know education is a real important aspect of this. Also, we recognize that there's not going to be but so many vaccines out. And then there's going to be a need to somehow triage how that's going to be distributed. We recognize and understand that the nursing home community will be one of the first that receive the vaccine. Nurses, doctors, other first responders, and then we'll probably start getting into, I don't know, we haven't heard a lot about prisons, but we know prisons, meat factories, and other places where people are working in close quarters are also very dangerous places for the COVID-19. But we also know African-American communities are on the list. The question is with what will become available, if there is not a loud noise or a loud interest in the African-American community to get the vaccine, there is a question as to whether we will. And there's also a question that even if we want the vaccine, whether we will after you start really going down the list of the priority groups that need to get the vaccine. So I can't really answer that question directly, except to give you a glimpse of the world in which African Americans live by my own experience. But I have to say that had you asked me on April 3rd, when I contracted the virus and I only had 30% use of my lungs and 104 fever and, you know, racked in pain like I couldn't believe it, like a lot of women are on this phone, worse than having a baby, I would have taken anything. In fact, I was given hydrochloroquine. So I would have taken anything, I would have done anything. So this is the world that we're living in. I can't give a direct answer as to how comfortable I am about doing or taking the test tomorrow if it were me. But I say to you that we could have saved lives had we had a vaccine. The question is, what things should we be doing and saying, and how much education can we do between now and the time that the vaccine will become available for our community? Dr. Taylor?
Yeah, I want to just build on that. I mean, I think there's several things. First, and I think at the top of the list, we need to realize that there's always a danger in the African-American community that when the vaccine becomes available, that we may not be in that pool at a high level. So my view is that at this very moment, we need to begin to huddle up and develop a very specific plan, just as we developed a plan before. And at the first of that level, plan should be our communication strategy, because it's going to take massive levels of education to convince people to take the vaccine. I mean, I've heard people already begin to say, I ain't taking nothing until a year or so when I see what happens. So taking that into consideration and taking the resistance that we're going to find, we need a real strategy, and we need to be able to put that into place now. And by real strategy, I'm saying that we need to look at what are our target populations? How are we going to reach them? What are the vehicles that we're going to use, especially in an environment like we're in now, where traditional gathering places don't operate and work? I think we have enough data where we can begin to sit down and do that. And how do we develop a strategy that is culturally sensitive to African Americans and speaks specifically, to their fears? Who will deliver the message? What will be the multiple vehicles that we will use? Radio, contacting pastors to reach into their congregations, identifying opinion makers in different levels. So just at that tier, I think we need a plan, and we need to be working on the development of that plan, right now. And I think this is something that in the earlier period, when Raul Vasquez and others developed a plan, that allowed us to move forward. So at the first level, it's the information. How do we get the word out? How do we convince the people that we think they should take the vaccine? The second tier is within the African American community, we need to identify our own priority groups. Where are the elders? How do we reach that elder population? Where are the frontline workers that we want to be there? Who else do we want to see at the top of that list, so that when they start to roll out, we can already point them in that direction? So not only do we need to know these groups, but we need to know where they're most likely to be clustered. Where are they within the African American community? And we need and there are ways that we can begin to use GIS and some of the other material and information that we have already to identify where critical clusters might be, to help guide both the information delivery. And the final part of that is we now have to identify strategies for for actually doing the vaccine. Probably anchoring around places where we already have our distribution centers and people are comfortable going there. And so to kind of summarize that, I think that we've already laid in Buffalo an infrastructure with the work that Pastor Nicholas and others have been doing, along with Pastor Pointer. So there's already this network of out there. So that in summary, number one, we need to develop an education strategy with specific targets. Number two, we need to be able to identify our own list of critical persons that would be first tier in terms of getting that. And third, we need a space-based strategy in terms of exactly where do we want centers where the vaccinations will occur inside of the communities. And I guess the final piece is start lobbying tomorrow with our folks in the county so that we know when we get to this point a little farther down that we're ready to go. But even now, we should begin to ask for the dollars and the money and the resources to get the planning done.
And we've already been engaged with Senator Tim Kennedy, who's been a great partner. He's been our leading political champion in our work. And I think we have something scheduled with him pretty soon to engage in a conversation with him so he can advocate for us at the state level. Next question.
Time is ticking. I don't want to keep people too long tonight, but I know that one question that's running through a lot of people's minds. They want to know, how can students, how can, folks contribute to efforts by the task force? What's needed? Feet on the ground, money, what can help?
So I think, the first start is to go to our website, take a look, read, the work that we're doing. And to send us an email, and we'll have individual conversations with you, about what you want to do. One of the things that I think Dr. Murphy could probably attest to that is that my approach is I always want for people to operate in their gifts, their strengths, right? And so finding out, from Dr. Grinsley, what do you do? What do you have? And so how can you get that as opposed to asking for them to do something that they just don't have the capacity to do? So make a self-inventory in a sense of say, what do I bring to the table, right? And figure out how I can invest it. Money is always great because, and here's why, we're feeding people on a weekly basis, and there are people on this call now that, looking at who have already invested in us and stuff. So we take the dollars and we put it right in. Really, at this point, our main priority right now is in terms of benevolence is making sure that people in our community get fresh food, healthy food. So one thing different about our food pantry is that you're going to get fresh food, fresh fruits, fresh vegetables, produce. We give people meat, and we give them recipes and things of that nature so they'll know how to prepare this stuff. So it's not just, and I'm not taking a hit at, people that just give out canned goods. I mean, if you don't have anything, but we have to be careful though, because sometimes, and you guys are all, in the medical field, some of the food that people get in food pantries feed the diseases that we're trying to prevent them from getting. Right? So we have to make sure that when we give people who need food, we want to get them food that's going to make them healthy. And sometimes we got to go buy that. That's not stuff that, when you go to Wegmans and say, hey, this is the stuff we want you to donate, they're not donating organic vegetables, right? They're giving you, as much ramen noodles as you can put in your car, right? But we don't want that sodium, and that's found in that stuff to drive our people's blood pressure and diabetes up, right? So that would be it too. So, log on to our website, send us an email, and, if you feel like you want to invest, we can do that. Is that fair? And then have these conversations in your own spaces. The best thing is for white people to have conversations about race when Black people aren't around. Do you know what I mean? and just say, hey, what do we think about this stuff? How do we feel about it? And how do we feel like we can make things better?
Thanks. And one of the things we'll be sending out too is some information about how folks can send donation checks or donate food to the pantries. We'll send that out in a follow-up email.
Thank you.
The original plan, yes. Dr. Grinsley, do you want to add anything? I want to be respectful of everyone's time. It is 7 p.m.
I know everybody's trying to get ready to watch the football game. So we won't have anybody out here at 8 o'clock. So we might as well just get ready to wrap it up.
Well, I think we could probably have this conversation extended and we would all benefit from that. But in the interest of time, I think we will say pause because I think we all have something to think about and think about ourselves and our relationship to our peers in our community and within our own organization. I think we've, as a task force and as a university, I think we've made some huge strides in the last several years, and we just need to keep on that path for everybody's benefit and welfare.
I want to thank everyone for attending tonight. This was a really insightful conversation. And as a sociologist, I really appreciated the focus on structural and systemic lenses tonight. As I mentioned, we will be sending out a follow-up email. It's going to have a brief feedback survey in it, and the information about donations, and also a link to the recording for the event tonight. And I apologize we didn't get to everyone's questions, but I do appreciate all of the interest that we've had in this topic, and we will be continuing this conversation at a later date.
And we would be happy to, engage in conversations, with other departments and what have you. We really we're here to serve, we're here to work in collaboration. And I just want to say publicly, thank you to Dr. Grinsley, because she was really one of the first partners from UB that came in and say, hey, I'm ready to roll up my sleeves. And not only that, but I'm gonna get them folks down over there at UB to come help us out. And she was a woman of her word. So we really appreciate her commitment and her partnership. Valued it.
Well, on that note, I will thank everyone for attending tonight. Go out there, be safe, stay healthy, and thanks for coming.
Bye.